I am a clinical allergist, first of all, and I am working at the University of Ancona in the middle of Italy. And my field of interest is mainly represented by hymenoptera venom allergy, food allergy, drug allergy, and anaphylaxis. And I have directed all my research on this topic.
Great. Could you tell us what your experience with EAACI is?
As a clinical allergist, I have been on EAACI venom hypersensitivity subcommittee for some years ago. First as a member, then as a secretary, and lastly as a chair. And later on, I also have had the opportunity to be on the EAACI Executive Committee, first as an interest group representative and then as a member at large. And at the same time, I have also the opportunity to serve EAACI as the editor of the EAACI newsletter. And during the last 2 years, I served EAACI as the chair of the National Allergy Society Committee. So that commitment to EAACI represents for me a great personal and professional pride.
So Beatrice, could you tell me what the National Allergy Society's committee is?
The National Allergy Committee is an interactive platform and is made of a representative from each European National Allergy Society member of the EAACI. It is coordinated by a chair and a secretary, and it also includes the chair of the International Society Council. The committee was launched in September 2015. Nevertheless, currently it has made of 57 society from 41 European countries plus 23 society from non-European countries. And more information are of course available on the EAACI website. The main goal of this committee is to increase the interaction and the trust between EAACI and the National Allergy Society, including educational and scientific activities, lobbying, public campaign, speaker support programs, and of course promoting the collaboration with the National Allergy Society is in fact of a high priority in EAACI. And I am personally convinced that this is a unique opportunity to join forces in order to ensure the continuation of our work to reduce the burden of allergic diseases in Europe.
What is the role of the National Allergy Society Committee chairperson?
The role of the chair of this committee is to bring together all the National Allergy Society and to facilitate constant communication and also to improve collaboration on specific issues and activities through the promotion of new ideas and instruments. Moreover, the role of the chairperson is also to collaborate with the specialty committee, with the patients' organization committee, and also to promote best clinical practice among the national societies, and also to engage society representation across Europe, for example, in terms of membership of public campaigns and, for example, lobbying at the national and European level.
What projects is the committee actually pursuing at the moment, and what will be ongoing in the coming year?
Even though this committee was founded just 4 years ago, many projects are going on. For example, when the Academy launched this committee, it was established that 3 registers would be very important to be established. One register on specialty and allergy care, for example, another one on European European and international guidelines, and the third on allergy research. Just to give you an example, the register on specialty and allergy care is based on a survey prepared by the NAS and the UMS. And this survey, the first results of these surveys have been very recently published as an EAACI position paper. And this survey clearly shows that even though in the majority of European countries the full specialty of allergologists has been already recognized, however, the spectrum of allergy services is very, very heterogeneous in terms, especially in terms of number of specialists and in the training of specialists, leading to the conclusion that a more harmonization in training, as well as more investment and more involvement of the young people, is urgently needed. In addition to these registers, the committee, the National Allergy Society Committee, address future challenges by establishing, for example, some working group. 4 working group has been established: working group on health, economics, and UA lobbying, for example, working group on membership, working group on education, and also on specialists. Just to give you an example, the creation of the working group on health, economics, and UA lobbying arises from the need, the urgent need to highlight the benefit, the political, financial benefit of an early diagnosis and the proper treatment of allergic disease, as well as to approach, for example, and to urge political institutions to prioritize action in favor of allergic diseases. And moreover, a very new project coming from the NAS committee is related to the involvement of young members. Since the young member assembly is the biggest group within EAACI, and also EAACI wants to promote and wants to give more visibility to the work done by the junior member at local level. A NAS junior member committee has been very recently created with the aim to translate and disseminate European guidelines, for example, or a position paper, involve young members in all the NAS activity, as well as to promote within the EAACI JMA-oriented activities and projects occurring at a national level. So, as you can see, it is very big work, but at the same time a very exciting challenge.
Thank you very much.
Welcome.